It's estimated that 2 out of every 100 children in India suffer from keratoconus. It's a severe eye disease and is a leading cause of partial and complete blindness in teenagers in India.
Keratoconus is a condition that affects the cornea. The cornea as a structure is similar to your watch glass and acts as a window to the world. It actually is responsible for majority of the focusing that happens in the eye, and typically it is dome-shaped. In keratoconus, there is a thinning of this cornea, and that causes it to become conical in structure. It could be caused by genetic conditions or could be associated with certain systemic diseases. Very often we find it in children who excessively rub their eyes or have other allergies. In clinic, we diagnose keratoconus by mapping the surface of the cornea and measuring its thickness across various regions using a sophisticated equipment that we refer to as a topographer.
This is a corneal topographer. It has a head and chin rest. It is non-portable and it needs to be connected to a computer. This is how the patient's corneal image is captured on this device, and this is how the output looks.
Such equipment remains inaccessible to a large section of India's population. The device costs upwards of $10,000 or 7 lakh rupees, and even in urban India, a keratoconus test usually costs more than 1,000 rupees.
We propose SmartKC, a low-cost, portable, easy-to-use corneal topographer. The SmartKC system has 3 key components: a 3D printed Placido-based smartphone attachment, which weighs only 150 grams and costs less than $30, an AI-enabled smartphone app that enables even a non-medical staff to capture high-quality corneal images, and an image processing pipeline that takes the captured image as input and outputs corneal topography heat maps. The generated heat map can then be passed on to doctors for diagnosing keratoconus, or it can be fed into automated keratoconus diagnostic systems.
This equipment can be used anywhere. All we have to do is switch on the app and it will guide us to get a very good corneal image. And this is the final outcome we get.
In collaboration with the Sankara Eye Hospital, we have developed and evaluated our system on hundreds of patients' eyes and achieved a specificity and sensitivity of above 94%. This means that we can diagnose keratoconus with a very high precision. Right now, we are working towards scaling this system to multiple hospitals.
I see a huge potential for SmartKC. Imagine a healthcare worker or a teacher anywhere in the world using the SmartKC and a smartphone to periodically screen children for keratoconus. This could help us pick up this condition very early and intervene to ensure that they don't lose any vision. This has actually inspired us to now collaborate and look for low-cost solutions that could eliminate needless blindness across the world.
This work has been open sourced. Please go to the link on the screen to learn more about this project.